For an invocation?
I am.
Well, you go right ahead.
We'll do it now?
Yeah, we're just about 45 seconds from 2
Okay.
o'clock.
Okay. Hi, Wayne. Well, it's good to be with you today. Every January, I try to read the Proverbs. It's 31 chapters and 31 days in January, so it works out real good for me. And one of the ones that sticks with me is Proverbs 3, verses 5 through 6. It says, "Trust in the Lord with all your heart. Lean not to your own understanding. In all your ways acknowledge him, and he shall direct thy path." That's a pretty good one to live by, isn't it? Let's pray. Almighty God, we thank you that you are there and willing to direct all who will's path in life. We go through many changes, and yet the Word says that you never change. And God, you know what we're going to meet before we ever meet it. We just lift up our national, state, and community leaders today. Been a lot of changes in those offices. But Lord, we still need your direction. We need your hand of mercy upon us. We thank you for peace in America. We thank you, Lord, that you are the one that settles all those things within our hearts. And we look unto you for our future. For you said that Jesus is our hope, and he prepares a future for us. And so today, as we meet this agenda with these people, we thank you that all will go well, that they'll follow it in integrity and honesty, do the best we can for our community in a better way. In Jesus' name, amen.
Thank you. This meeting of the County Commissioners is now in session. Please join us for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, fellows, if you've had a chance to read minutes from our January 19th meeting, do you have any additions or corrections?
I'll move to approve the minutes of the last meeting.
Second.
Okay, I have a motion and a second to approve the minutes from the January 19 meeting. Any discussion? All those in favor signify by saying aye.
Aye.
3 ayes. Okay, department reports. Area Plan Commission Director Bill McDaniel, where are you? There you are.
Good afternoon. Thank you for being able to put this on so quickly. But most of the speaking will be Brian Durham. He's president of the Area Plan Commission this year, and of course also, what's the official title with the Chamber of Commerce? Director? Executive Director of the Chamber of Commerce. And I'm thankful for Brian with this because he's showing us both the president of the Plan Commission and the executive director of the Chamber of Commerce. He's being a ball of fire and trying to help us get things taken care of with the zoning code and then also the comprehensive plan. And this today is to help us get some intern assistance for both of those big projects. And
so I spoke to you guys last week about seeking interns. So today I'm formally asking for approval to seek interns for 2 projects, one being the comprehensive plan, the other one being an update to our existing zoning code. The formatting's pretty terrible on it. There's a lot of issues within the code that needs to be changed, and just having some additional free help from a college intern would help make Bill's life easier. There's no cost to the county for this. We have a great relationship with Earlham College on their public policy department, and one of the requirements for graduation is an internship. So there's a few hundred students who are in that need an internship sometime before they graduate. So we have a large pool to pull from. Myself, Bill, and I was going to ask Dale, who is your representative to the APC, to be on the committee to review the resumes to select our 2 candidates, assuming that you approve seeking interns. Let me know if you have any questions.
Who pays for these interns?
Earlham has a grant that pays for their internship. So every student who graduates from Earlham is guaranteed a paid internship.
You get a stipend for it.
Yeah. So they get paid through Earlham College.
Okay. Is this a grant that would require Jaleesa Bates's?
No, they handle it all.
Okay.
We're just bringing them in to do work, basically, and complete the project. Some of it will be remote, some of it will be meeting with Bill.
Okay.
Is there any type of a liability on the county side?
I would think maybe one thing we would probably need is to get the authorization from the county commissioners as far as the GIS access. Just a big part of both of those are also going to be involved in GIS. So whatever needs to be done, and with whatever types of agreements are necessary between the commissioners and the interns as far as, so they can use the GIS or other information from the county.
Are you saying more than just what's available to the general public on GIS?
Probably will be, because what we'll look for is creating layers, because a lot of what's done on a comprehensive plan, there's creating new maps. So there's going to be a lot of new information that's going to have to be generated by the map. And so.
As far as a liability, as far as being an employee, no, I don't think that there's a liability on that.
No, I don't think there's that, and I was trying to think of any confidentiality issues, but I don't know if there's going to be much confidentiality issues either.
Because everything's
Public information.
Yeah, and public hearings
I mean,
required.
Mr. McDaniel is correct in the fact that if they're able to access something that they could start messing with things, that might be. But we worry about that with every employee we have that has inside information. Inside.
There's a big, in my mind, it would be comparable to in the past when we've had for various projects is the consultants where the commissioners have had granted approval for them to have access to, in some cases, specific data layers, and other times, in this case, it'd be pretty much need to be everything. So they need to have access ways as far as utilities, roads, parcel information. I can't think of anything they really wouldn't need as far as that. Anything that falls on the legal side with courts or anything else that's been done in the past, no, nothing like that. So just be land use and land use related.
I would think all those little details, Bill, should fall under the purview of your authority as Director of Planning Commission, you know?
Well, I just like to be careful with that, because is anything that may need, because the ultimate owners of the data are the commissioners. So I just like to make sure that everything is cleared with the commissioners, whatever might be need to be done so they can legally have it. And typically there's also constraints on how they can use the data. So for example, what they're doing with the data would not, they'd be prohibited from using it for their personal use.
Yeah.
Yeah. So if it would be safe. Now, another one is, when I was working on my master's, is I did have access to someone else with their GIS for a master's project, so I had to get permission for that. So if there's a possibility one would need to use it for an actual project, they would probably want to get that approved by the commissioners also, since it is proprietary information.
Well, it wouldn't make any sense, though, give them a job to do and no tools to do it with.
Yeah. That's why we want everybody to actually make sure they're approved to be able to use it. Because WTH, in order to release someone else to use the data, they need the county commissioners to release that person, to say that, yes, this person can have access to this data. Because if they are going to work remotely, yeah, they'll need to do that.
Sure.
Oh, one more thing, because since they're also going to need training from WTH, they probably don't have the same program. I think we'd also need to grant them permission to get the training that would be done with me or the surveyor's office from WTH to train them on using the software.
That's all figured into the grant.
Oh, how long are these internships good for?
Right now, I have it tentatively ending in August. So it's just for the summer, thinking like a March to August. I'm hoping to have the comprehensive plan done by August, so That's my goal, is to have it done by July.
That'd be phenomenal work.
Yeah, that's only a lot. But on the other hand is that there may be a possibility that starting with next year, we may need more assistance to do some other work with it. So it may need to get the approval for a new group as far as after August.
Okay. Well, fellas, what do you think?
So what do you need? A motion to approve the grant, or what is it?
Motion to give them permission to make the initial application for the grant, to provide the interns, and to give the interns the access to all the GIS and any other information that's pertinent to their assignment.
Okay, I'll move to do that.
I'll say.
Okay. We have a motion and a second to grant the
Provide assistance.
request to apply for 2 internships and to provide them with all the pertinent, access to all the pertinent information that they will need to do the work that you two guys would require them to do. Does that sound okay to you? Okay. Any further discussion? All those in favor signify by saying aye.
Aye.
3 ayes. Anything else, gentlemen?
Yep, thank you so much.
Okay.
Thank you.
Our grant administrator, Jolisa Bates, is here. Do you have the Fayette County Transit claim this month for us?
Yes, I do have the information. As you know, one of the things that NDOT requires of us is when we get ready to submit that quarterly claim is to come before the commissioners and ask for permission to submit the claim. All we're doing is asking for reimbursement for expenses that the transit center has spent for last quarter. It looks like they had a total allowable expenses of $100,146. They had revenue of $4,749. And so the federal share that we're drawing down for this claim is $49,042. And the state share is $46,355. And I just need the commissioner's approval to go ahead and get that claim in so we can get the money to them.
I'll move to grant approval to go ahead and get the claim.
Second.
We have a motion and a second to approve the filing of the
Transit
claim for the Fayette County Transit. Any other questions? All those in favor signify by saying aye.
Aye.
Motion carries 3-0. Thank you, Jolisa.
You could have phoned that over and saved you the trouble walking over here, you know.
County Assessor Jeff Coleman, you have a 144 request this month.
Yes. I have a name. Found someone, one of the people I would like to bring in to fill the position of reassessment clerk. Her name is Deborah Dunaway from here in Connersville. She has experience working with sales disclosures and legal descriptions from her job experience in the past, and I think she'll be a good asset. And I'd like permission to hire her.
Okay. Think she'll be able to get along with you?
I think so, yeah.
Okay, well,
So
she-
far, I haven't found anybody that dislikes me. So.
All right, if she get along with you, that's the
She got nerves of steel.
that's the main requirement right there.
That's it, yeah.
Okay.
I'll move to approve the 144 for Deborah Dunaway.
Second.
Okay, we have a motion and a second to approve the assessor's request for 144 to hire Deborah Dunaway. Any further discussion? All those in favor signify by saying aye.
Aye.
3 ayes. Anything else, Jeff?
That's it. Things are going good. We've just got a lot of work to do.
Good. Okay.
Thank you. I appreciate it.
Okay, thank you. Is county clerk here?
She
Lavonda, would you like to speak to this thing on the agenda?
Well, I will stand over here and let you.
You gotta do talking for two, you know, it says so right here.
I will stand over here and let you approve the request to make the amendment on the resolution to the deposits, the daily deposits in unforeseen conditions and circumstances, to do it on a Tuesday and a Thursday as opposed to daily when it's the situation that we have right now with US Bank. And any other foreseen circumstance that would happen in the future, that we would have to resort to this, that we have it in the clause that we have that to turn back to. As it stands right now, Lisa and I both have to travel to Hagerstown every day for the next 2 weeks to make this deposit, as according to statute. But if we place something in the resolution that states that we can do it on a Tuesday and Thursday, that would help us out tremendously.
Well, I want to do everything I can to keep you here.
I know.
We don't need you in Hagerstown, I need you here.
You need me in the building, I get it.
Right.
I can cause trouble that way, so.
Well, for the benefit of the listening audience, I'll go over this a little bit. Many of you out there know that this week the U.S. Bank closed its 30th Street branch for a period of 2 weeks because of a COVID outbreak within the workforce up there. So the nearest U.S. Bank branch where deposits can be made is Hagerstown. And we have a directive from the State Board of Accounts that will allow us to make 2 weekly deposits rather than daily deposits, which is normal and customary. And this ordinance that the county auditor put together today gives the county treasurer and the clerk authorizing them to make 2 weekly deposits rather than daily deposits. That way they won't be going to Hagerstown. That'll mean 4 trips to Hagerstown if the bank stays closed for 2 weeks.
Not necessarily, because we also, Jane had gotten in touch with Lori Rogers at State Board of Accounts, and as long as we've got internal controls in place, either Lisa or I can take the deposit for each other's office. And we've got our documentation in place in order for that to happen. So we are able to have our internal controls in place for that to happen. So it could be just back and forth for just her and I, 4 times for one of us, either one of us, not both of us at the same time having to go and making it 8 trips. It could just be one of us 4 times.
Well, I thought one you had to be a guard.
I thought you were going to do that.
I can do that,
I know you can. I know you'd be more than eager to be helpful.
I'll move to approve them being a twice weekly deposit.
This is, Mark, this is resolution number 21-R-1.
I'll move to approve that resolution.
I'll second.
All right, we have a motion and a second to approve resolution number 21-R-1 to authorize 2 weekly deposits by the treasurer and the clerk instead of daily deposits. Any further discussion or question? All those in favor signify by saying aye.
Aye.
3 ayes. We'll sign this today and you'll be on your way.
All right, sounds like a good plan.
Okay.
Thank you.
Extension. Heather, are you here? Yep. That's you behind the mask, huh?
That's right. Hello, everyone. Dale, welcome. I just want to give you an update from our office. 4-H enrollments for this year so far are at 366 approved members. That's about 20 less than last couple of years, but we still have some pending. So that's just, we got to make some changes and some fixes in the system before we can approve them. So we're on track to be just as many or more than we've had the last couple of years. So we're very excited about that. We have a new online system. You know, COVID last year kind of put a few kinks in the 4-H program, so the numbers we're super excited about. Our NEPA and Community Nutrition Education Program Assistants and Community Wellness Coordinator Becky, Carrie, and Kelly, they're working right now on continuing some food distributions, and along with their food distributions, we want those food distributions to make people sustainable. We don't want to just give the food away. So they work on helping people read nutritional labels, give them recipes for the food that is distributed out so they can continue to use that on beyond just itself. And Carrie is working on a program called Teen Cuisine in February and March. That will be teaching teenagers in our community outside of school. She'll be teaching them ways to do the same thing, read nutrition labels, learn how to manage money when they grocery shop, how to create a grocery shopping list, just get them some basics on that. Rhonda, our HHS nutrition educator right now, she is teaching Tuesday, Wednesday, and Thursdays at Community Christian School. She's got a really great program working there with that principal where they're teaching them science, life skills, health, nutrition. She's been teaching that since November, and hopefully she'll be able to go through the end of the school year with that. So that's a great connection for us. My ag natural resources programs, I've got several programs coming up in February and March I'm really excited about. One is Annie's Project. It's a program for women in agriculture, and it we limit the class to 20, so it's a more intimate setting so that people feel comfortable asking questions. We have guest speakers that come in for grain marketing, insurance, drones. We're having somebody come and talk about drones this year. I'm going to be talking about succession planning for farming. So it's a 6 weeks course. It'll be in Union County this year. We're going to work together to do that program. And then I've got a succession planning virtual program every Monday in February. Then I'm working with the state team from 4-H, from Purdue to do that. So I'm really excited about that program as well. And then 4-H, like I said, the numbers are strong. Planning is always happening for the fair. As Dale, I'm sure you're familiar with that. So there's never a break. We had Beef ID Day on Saturday just this past week. That went really well. Any in-person activities that we do with Extension, there has to be an approved safety plan that we turn into the state office 3 weeks in advance. It has to be reviewed and approved by the state Extension director, and then we can go forward with that. So we like to do things in person as much as possible. We're pretty much pros at these plans now, so we're pretty efficient at doing those as well. But we just like doing things in person as much as possible if we can be safe and get the approval. So, you guys have any questions for me?
You guys got any questions for Heather?
Ooh, March 24th, we have our annual extension meeting. We're joining with Soil and Water, and we're doing our annual meeting March 24th. You'll receive an invitation for that coming up. It will be virtual, and it will be 6:30 in the evening, I believe is the time. But we'll get you that information as soon as it's finalized. I think that's a Wednesday night, March 24th. And then, oh, sorry, one more thing. The annual report from Purdue Extension, which covers all 92 counties and different stories of success that we've had over the past year, that's coming out this month. You'll all get a copy of that annual report as well. And the really exciting thing is it's a big deal when your county is in the report. And Fayette County is going to be in there twice this year through different programs that Becky Marvel has done this past year. So we're super excited about that. We'll definitely mark those pages for you to read, and that's a big deal. And so we're pretty proud of Becky. Anything else?
Well, thank you, Heather.
You're welcome.
We've got the best team in the extension office right now that I can recall. So you're really doing a good job, you and everyone down there, and I appreciate it.
I appreciate that. I appreciate you saying that. We're working hard as a team, and we all love this community, and that's why we're here, and we're going to keep moving forward. So let us know if you need programs, if you hear programs you want people to do you know, we're happy to do whatever needs done for our community.
Okay.
We're happy to serve. All right, thanks,
All right.
everybody.
Thank you. I don't see Matt Shirk today. I guess he's not going to be up here. Highway Department, Jay, do you have anything to report?
Good afternoon. We had a busy weekend. Believe me, we went through almost all of our salt. So I had to order 250 ton today.
You wasn't supposed to do that.
I know. Don't tell me. We were down one truck. We had a truck we took down up last week to Greens Fork because he was busy working on other vehicles in the garage to be checked out. And that number 6 truck, the one Chuck used to drive, the sleeves on pistons were rotating inside the motor and was causing it to miss because they were working loose. So they were tearing it down up there, getting. I won't know what the cost is going to be for it till they find out for sure what all they got to do. But it's a good truck. I mean, you can't just let it sit.
No. I never heard of piston sleeves doing that.
I've seen them come loose before, but I would just wonder how long they've been loose. If they haven't been getting worse, because it's always had a shake to the motor since the day we got it, and nobody could figure out why it would shake. It's a Mercedes motor; they're not supposed to shake, but it run good and everything. But it always had a shake to it. But they got it all tore apart up there, so.
If it ain't one thing, it's something else.
When you run them like they do down there, it's hard on them.
Yeah.
We replenished our sand pile. That's how come we're low on salt right now, because we had mixed a bunch more sand up. We're supposed to have some more coming this weekend, but we want to make sure we got enough salt to go along with it too.
Yeah, for sure. Well, as of today, I think, are we looking pretty good today?
Yeah, we got all the roads are clear. There was some drifting this morning back up in Bentonville in the areas. All your east and west roads, the wind blowed from the north, and that's just the nature things up there.
Yeah.
It was a foot and a half deep going across the road, so they went up there and plowed them all back. Sanded what they need to sand.
Well.
But yesterday when we was in there, man, them roads were slick. Because we went in and plowed on Sunday to push all that wet snow off. Well, what had melted on the road froze overnight, and then it snowed on top of it. So we come in early Monday morning and hit it again, and that's the first time we've had trucks off the road, and we had them off the road Monday. We didn't hurt any of them, but they learned a valuable lesson. You don't stop on a hill.
Well, I haven't heard of any serious accidents because of the weather this weekend.
You're allowed to hear a lot of complaints about mailboxes because the snow will take them down.
Yeah,
I told
I've seen a few already.
If this shows a sign that we run over a mailbox, we'll put one back up, but we don't touch them if the snow knocks them down.
Yeah.
We can't, they slow down, you still can't stop the snow from knocking them down as wet and as heavy as that snow is.
Yeah, when you're throwing that slush is
Yeah.
really heavy. Yeah. Okay. You guys got anything for Jay? Is that all you got?
Oh, we got one man off too. He's off on the FMLA right now because he's having trouble with the disc in his back. And I don't know how long he'll be off. We'll just have to watch and see.
Okay.
So, that's it.
All right, well,
Okay.
thanks, Jay. Surveyor Bill Mackey. Bill, do you have anything for us today? By the way, we've got a public hearing scheduled for a couple of weeks away. Are we going to be ready for that?
Working on that report, so.
Okay.
I don't think we're gonna be able to, as a heads up, I don't think we're gonna be able to do it in a couple of weeks because we have to give 10-day notice for a public hearing. Can't do that until you have the report, so we might try to schedule a special meeting. I don't wanna wait a whole month.
Is that 10 business days or 10 calendar days?
10 calendar days.
Okay.
It's gotta be notice, not just notifying the paper of the meeting, but they actually have to publish the notice. Which Jane has that already to rock and roll. It's not that, it's just he's prepping the report, and as soon as that report's done, then we'll do it, because they have to have time between that to be able to object to anything he puts in their report.
Okay.
But I wouldn't, we can always wait, but I don't see any reason why we couldn't have a special meeting before that if it needs be. But I'm just giving you a heads up. I don't know whether we'll make the deadline for the next meeting.
Bill, can we put a day on when your report will be done?
I'm not sure yet. I have so much other stuff I have to get done right now. Got that report, get to James tomorrow. So I've had so much other things, I haven't really had much time to work with.
Okay, well then if we can't carry through with that February 16 date that we previously set, the principals involved will have to be notified. There's going to be a delay in this thing. They're no doubt expecting it, but I got
I don't know,
no.
has he sent out notices yet?
Yes, not.
Yeah, I don't think that they've notified the adjoining landowners yet, or the impacted landowners.
Well, if it comes to that, do you guys object to having a special meeting for that purpose? Well, as soon as they let us know, we'll know.
I mean, even if we just did the next, I'm just saying if we wait until the next drainage board, but even if we just did the next commissioners, that would be a lot quicker.
Yeah, sure. Well, very possibly, there could be a lot of interested parties in this now.
Right.
So
Right.
if it's not going to be on the 16th, maybe perhaps a special meeting later in the month would work best.
We could always do 1 o'clock before the next commissioners meeting, and then we'd have a full hour. Because we wouldn't have the first meeting of March, and then we wouldn't have any, then we wouldn't have the 1:30 drainage board, so we could have a full hour.
Yeah,
That would probably be my recommendation. That gives him a couple more weeks to work on it. But the more I looked at the rule, I mean, we can't have it until we get that report. We can't schedule the hearing.
okay.
And I really hate at this point to schedule, he's as little backed up as he is, I'd hate to schedule the hearing and then him not even have the report done or something. That would be bad, so, because that wastes a lot of people's time, so I don't want to do that.
Okay, well, thanks for catching us up on that.
You know. But I think it would be my recommendation that we shoot for that March 2nd, and that would give us, February 20th, well, February 18th range to get it in the paper before then, so that gives a couple solid weeks.
All right. Mail. You guys got any mail you want to share?
I don't have anything.
Anything on the old business you want to bring up?
I think you got Michelle back here.
I did one.
Oh, I didn't see her. I didn't see you back there, Michelle. Did you have anything you wanted to?
No, I don't.
Okay.
You can sneak something in if you want.
Okay. We have Dr. White, the county's health officer, here today, along with Charlene Gabbard, to give us an update on the harm reduction program.
Yeah, thanks for having us in here, and I represent the health department. Matt was going to come up here with me, but right now we're in the throes of the vaccine clinic. We're doing about 200 shots a day, 10 every 10 minutes. We're doing 4 shots, so you really got a factory going down there. And I encourage anyone over 65 to get your shot as soon as you can. And back in 2015, we had this whole problem with heroin in this town. We were putting up some big numbers with overdoses, deaths even, I think 12 in 1 month in the fall of 2015. And I declared our county an opiate emergency, and that opened us up for monies to support a harm reduction program, and better known as the Needle Exchange Program, but it's got different euphemistic names now, and Charmin will bring you up to speed on what we're trying to do is to expand that program. This is our third 2-year cycle. It'll expire probably this fall 2021, I think. About to reapply for it, but so far so good. I think this has been an unbelievably beneficial program for our community. We elected to have Reed run it for a while, and then when they bought the hospital here locally, we transferred to Meridian Health, but we're running out of room up there. And Charmin's here to fill you on, and her addiction counselor, is Lauren Showalter is also with us today.
Okay. Hi,
So,
Charlotte.
hello. So we come with two purposes today. One, I know Dell is new to the board as well. So I come to give an overview of exactly what we have been able to do in the past year. When we came before you guys in August of 2019, the exchange was actually closed because when we left Fayette Regional, then there was just no one there to take over. So there was some months where it was just down and there were no services here in the community as far as what we do refer to as, I guess, the syringe service program. But we're so much more than just a syringe service program, and that's what I kind of want to talk about today. You guys gave us permission to reopen, and then last year, January 22nd, we reopened inside of Meridian. We're not actually an entity of Meridian. They provided space for us. So when we reopened, we called an alliance. Reed Health provided funding for us. Meridian provided space. Family Services and Prevention Programs are the fiscal agent for this program. So actually, Dr. White oversees our program, but the county has no responsibility at all for our program. They provide no funding or supplies in any way for us. We partnered with a team from Indiana University, and it's Prevention Insights. So they had applied for a grant, a federal grant, focusing on rural communities and the opioid response. That grant will not be over until it ends September 1st of 2023. So the overview that I've gave you guys, what I want to talk about is right now, just since we reopened last year, we have 258 active participants in our program. We've provided over 1,200 doses of naloxone to our participants. Self-reported uses of Narcan is 521. That's those participants that came back to us and reported that they've used that Narcan either on themselves, it was used, or on someone else. Harm reduction education, that's just something where we're able to talk to individuals that have abscesses or other things, blood infections or things going on where like they come in with that abscess and I'm like, what are you doing? Let's talk about that, and we're able to provide resources or referrals or to give them supplies for wound care. And then referrals to treatment services. 21 is actually what we've accounted for, but that number is really low. And then Hep C and HIV testing, those numbers are low too, because when COVID started, we were directed by the State Board of Health to limit the amount of time and exposure that we had with our participants. So there for a while, we were advised to have like minimal contact. So we were only able to document certain things during that time. We now have been able to go back to full reporting and asking our questions. So that's kind of just an overview there of what we have been able to do. So I went on to report, we went ahead and we had overdose awareness events. We celebrated National Recovery Month. We held a community cleanup. And all of what we've done has just been done with volunteers up until now. We collected over 26 bags of trash just from 3 of our local parks. And during that time, we found 4 syringes. And those syringes were all found over behind Boers. And we've held trainings in our county for Narcan trainings, and then 4 surrounding counties have actually contacted us and asked us to do Narcan trainings for either community members or at peer support groups like Celebrate Recovery, NA, or Brianna's Hope. So then I go on to say that we've supplied over 2,000 doses of Narcan to our community, and we actually give the city police, the sheriff's department, and we have supplied I think 3 cases to our EMS at Horn Park Road. And going on down in there, I talk about the relationships that we've built, and we continue to build within the community and other resources throughout the state of Indiana. And on this second page, I have the objectives for this year to come. this brings me to the reason I'm here today. I'm here to ask for permission for us to move into our own building. We have outgrown the space that we have at Meridian. It's a small office space. We're grateful that they've gave us that space, but we have funding to be able to pay for our own building and our own services there. Meridian will still partner with and use them as a referral source, and I'm sure they'll come and give services there as well. We don't only use Meridian, we use Centerstone and we use Reed Health as far as referrals here in the community. But we want to expand, and we have looked at several locations. So I'm not here to ask for money. I'm not here to ask for anything from you guys other than to give us permission to move into our own space.
Have you already got a building?
We've got a building in mind, but if we're able to get your permission to move, we're going to have it looked at to see if we can get handicap, to make the bathroom handicap accessible, because it's not right now. And then the second paper that we gave you, it has Indiana University and then our logo on there. That's an overview of actually the objectives that we will complete by 2023. So in providing space, or provided that we get the space, we'll be able to have a drop-in center where people in this community that not even struggle with just substance use disorder, but mental health, or that are looking for that support like grief and loss, anxiety, depression, can go to, and we will hire and train 5 peer recovery supports throughout the next 2 years, and we will pay them. We have the funding to do that. We want to have that space that's just judgment-free, stigma-free, where people can come and say, hey, where can I get a treatment, center for my loved one, or I'm struggling with depression or anxiety. The picture that I have on that second page is an idea of what we will provide for individuals. We want to work with the jail. When people get out of jail and they don't have a birth certificate, we want to be able to pay for that birth certificate so that they can, get a job, or have a peer recovery coach take them to the license branch to get an ID. Just some of those little things that we don't always think about, that individuals need to be connected to the next resource. We have hired our first peer support. Lauren's here with us today. She's part-time, and so by the end of 23, we want to have 6 peer recovery coaches that from within our community, and have them placed in other programs at the end of 2023.
How do you get your funding?
Right now, Reed Health provides some funding. And then the grant that I mentioned from IU, it's a federal grant. And so we work with that team of specialists from IU. And then moving forward, we're working with Indiana Addiction Issues Coalition. And they have they want us to expand and provide additional peer supports. But we're just not able to because of space. It's just not practical right now.
Do you work with like the community corrections?
Well, Alana and Deanne, we do a lot of referrals for like Brianna's Hope, and so Alana and Deanne, and I've provided Narcan for some of the employees down there at Community Corrections. COVID has really put a damper on a lot of things. Bev from down at Community Corrections, she'll reach out when they need resources or referrals. We actually have a consortium, and Brandon Burgess from Drug Court is a member of that consortium, and we're always looking to add individuals to that. I just had recently met with the chief of police and to partner with him so that we can provide resources and Narcan whenever they respond to overdoses and individuals refuse treatment or don't go to jail that we want to leave behind with them or family members. So we're reaching out, and we're more than willing to work with anyone. Joey, I meet with Joey and provide Narcan to them as well. I just talked to Brad Rosser from the Drug Task Force about how we can help one another.
Charmin? Have you or Dr. White seen any statistical year-over-year changes between 2019 and 2020 and the level of use or anything?
So in all honesty and all fairness, with the CDC, the way the reporting goes, what we're going to run into from just the time that we opened in January of 20 until now, we won't have that data to support if there was any change or decline in like our Hep C or HIV numbers. And then we know nationwide that Corona has exacerbated the numbers of overdose deaths, and because the limited amount of resources. I mean, every community mental health center stopped seeing patients inside, or treatment centers, even like the homeless shelter, they stopped accepting people. So there was such a lack of resources. We know from May to May that this will be the worst year nationwide for overdose deaths. So it's not Fayette County, it's nationwide.
Yeah.
So what you want then is a building for the Fayette County Harm Reduction Alliance?
Yes.
I'll make a motion to that effect. We'll have a ready building.
I'll second.
Okay. You're quite a salesman. You sold these guys right off the bat.
You had to do a lot of talking, you know?
Yeah.
He just got tired of hearing me.
Okay, we have a motion and a second to authorize the Fayette County Harm Reduction Alliance. Is that the proper term to use?
Yes.
Okay, to shop around for their own building to locate in. And I'm sure when you find something, you'll give us a heads up where you're going to be.
Absolutely.
Okay.
Unless you want to talk about some more.
Nope, I'm good.
Okay.
Thank you so much. Thank you.
Okay.
Thank you.
Is there any further discussion?
Yeah.
All those in favor signify by saying aye.
Aye.
3 ayes. Okay, well, good luck on finding you a facility that is more suitable for your needs.
Thank you so much.
Okay, Dr. White, did you have anything else to add?
No, I love it that she's taking charge of this, because, I mean, Paula Moffett started this, and it was one of the model programs in the country. She was on the news and everything, and then, there's a lot of politics involved. The board, health board didn't want the needle exchange program in the department, and remember all that.
Yeah.
But then it moved out. Reed was good about letting us use their facilities when they bought, or Fayette Regional was helping us. But then when Reed bought Fayette Regional, they didn't buy the building we were using, so Meridian Health has been our building. And what Charmin's getting at is we need our own little place. It's gonna, I think it's gonna really help this community. We don't have the numbers quite yet because of COVID, but I'm sure we're gonna see a big improvement. And then Matt had another issue we wanted to bring up.
Yeah.
Okay.
That's 144.
Yeah. It's a surprise one.
You're
because,
hard on people down there.
Sue Flum has been working for us as a nurse, giving our vaccines. She's been great. She's a retired nurse, and she is a snowbird, which means she's going to Florida here for about 4 or 5 weeks. And I had somebody come in this morning for a vaccine, and happens to be a retired nurse, and I said, "Will you come work for us?" She's sitting down there now. So I asked her if she'd help fill in. It's Jenny Gross. I'm sorry, Jenny Gross.
Jenny Gross.
So I'm bringing a 144 for Jenny. So thank you. She is an LPN, so she would be perfect to help us. We did 88 this morning, and when we had 70-some scheduled this afternoon. So for us down there to do 88 in a morning, we have to have 3 people given vaccines. We tried to get by with 2, but we couldn't. We got about 20 minutes behind in about half an hour. So with 3 people giving shots, we were able to keep up. So, and with Sue leaving, it put me short. So Jenny will help out. That would be perfect. And then this will be paid out of the COVID money as well. So it's all paid through the grant.
Okay, I don't I haven't seen any mention about it in the newspaper. But this, if I recall right, you told me last week that starting this week, Fayette County's allocation was going from 150 to 700 doses.
We went from 300 to 700.
From 300 to 700.
We started out at 150, then went to 300, now we're at 700.
Okay, so we're up to 700 weekly doses now, and that's an impressive jump.
Yeah, I mean, we're doing, to put it in comparison, which is strange, Wayne County Health Department's getting 600 a week, and we're getting 700. So, I mean, it doesn't make a whole lot of sense, other than they have Reed, who's giving shots up there as well, and they have been helping out here too, so, because maybe that makes a difference on how many vaccines they get and how many we get. So we're getting more than all the surrounding counties, so that's great that we're able to get our community. And a lot of places are complaining that they can't get people in until March. This morning we had appointments available for this Friday, so, but I think they filled up today. But we're doing appointments for next week as of right now.
Okay. Are all your appointment slots filling up? I mean, are they?
Yeah, like I said, this morning I actually had appointments available for Friday. We're full for today through Friday now. I have appointments available for next Tuesday, so we do have shots available. We have appointments available starting next week.
Okay, that's good news.
Yeah. So basically, if anybody wants a shot, we can get to them, as of right now, we're getting to them. So now if we get a rush and get filled up for next week, they only allow us to make appointments for the number of vaccines they send us. So we got our 700 shipped to us yesterday, and that's when they opened up the whole week. So that's why we can't make appointments.
You gotta have the stuff to do it.
We can't make appointments past what they send us. So as they send us the vaccine, we open up for more appointments. But yeah, as of this morning, we had appointments available for next week.
Okay.
Do you give it all 5 days, or?
We're doing Tuesday through Friday right now. We were trying to keep one day available because we spend Monday, the whole staff spends all day Monday everybody that makes an appointment is not completely registered. So it seems like we spend all day Monday registering people because they go in, select their time, and then we have to get their insurance information. We have to do their demographics, and then a whole bunch of other questions to finish their registration. So we're trying to spend Mondays getting everybody ready so that when Tuesday they roll in at 8 o'clock, all we have to do is check them in and give them their shots. So we're doing we've set it up so that we can do the 700 over 4 days to give us that 1 day a week. And we're still doing childhood immunizations. We're still doing all our regular work on top of this, birth certificates, death certificates, and we are really it's tough to do all your regular office work when you've got everybody doing vaccines, but we're struggling, so I have to get back right now because I'm trying to do appointments on people for rescheduling, and I had to run off. So.
Okay, well, guys, you want to give him a replacement for?
I'll move to approve the 144 from Jenny Gross.
Okay.
A motion and a second to approve the 144 Health Department's 144 request for Jenny Gross to replace Sue Ann Flum.
We're both of them on staff.
Okay.
Sue Ann's going to be gone for 4 or 5 weeks. If we're still doing vaccines, she'll help when she comes back.
Just extra coverage.
Okay.
Yeah. So when she comes back, she's still going to help. So it's not necessarily we won't ever use her again, but it's all part-time. So we will, schedule one day, one the next.
Sure. Okay.
I sure hope we're not in 4 weeks still doing a whole lot. Hopefully we'll be somewhat caught up. So, but I doubt it. It looks in 4 weeks we're going to be still just doing the second round of shots we're doing now. So we're going to be still covered up. So.
Any further questions? All those in favor signify by saying aye.
Aye.
3 ayes.
Thank you.
Okay, Matt, thanks. That's all our regular agenda. Is there any patron concerns?
I'll move to approve the claims payable.
a motion and a second to approve claims and payroll. All those in favor signify by saying aye.
Aye.
3 ayes. We'll start signing here. Here's the, that ordinance is approved.
Is that everything?
I guess that's it.
I'll move to adjourn.
We have a motion and a second to adjourn. All in favor? Aye.
Aye.
3 ayes. Thank you all very much.